Justin Chase, what are those helmets doing back there? Are those college football helmets? Those aren't your alma maters, right? What are those?
Yeah, this is well, I'm an alma mater from Arizona State, so that's the big
Okay.
helmet.
Okay.
I'm a big Sun Devil fan, so but also a Colorado Buffaloes fan and an Oklahoma Sooners fan. So I got representation in a few different states. Just in case my Arizona State team's not very good, I've got fallback.
Yeah, but Justin, U of A is a fallback right here in your own state. Why are you having to go out of state for fallback?
Yeah. Arizona's a unique state. You are with one and only one, and there is no second. So,
is there a percentage breakdown? Is it 2/3 ASU, 1/3 U of A? How does it work?
I think it goes about 50-50 statewide. So obviously a higher percentage in the Phoenix area for Arizona State, but Tucson's very partial to their Wildcats. So
that sounds great. Hey, David, should we get this thing rolling here?
Hey, let's get it going, John.
Let's do it.
Welcome aboard Lifelines with David and John, your guide to charting the transformative course of crisis intervention and the game-changing 988 Lifeline.
So welcome back to Lifelines, the 988 podcast with David and John. And Justin, every week we're looking at the history of crisis care, going back to some of the foundations, and then casting our vision forward to 988 and the future of what crisis care could look like. But wow, what a great opportunity to be with you today and to think through. Arizona's had a outsized role because of some of the innovation that's gone on here. So, John, why don't you tell us a little bit about our guest today, our friend and colleague, Justin Chase?
Yeah, no, David, our distinguished guest today is Justin Chase. Justin is the CEO of Solari, and since before it was Solari, actually, back when it was the Crisis Response and Community Support Network in 2010, and it was just in the greater Phoenix area of Arizona. Now Solari is operating its outstanding statewide Crisis Now contact centers in Arizona, Oklahoma, and Colorado, where all those football helmets are from. And that's a three-peat that only the Kansas City Chiefs can compete with. So we're delighted to welcome to our podcast today, Sir Justin Chase. Justin, welcome.
Thank you. Happy to be here today.
Justin, we hope people will like and subscribe us on YouTube, watching this podcast, or wherever you get your podcast, you can catch up. But Justin, we like to get to know our guests a little bit as we get going, and we've already gotten a little bit of a background with ASU, but we like to do a segment we call the Super Fan. So, John, you and I are both going to take a guess, and I've known Justin for 15 years. We were colleagues together at Magellan Health when we first met. Justin, you were managing the crisis system.
That's right.
At that time. So I have a little bit of a leg up, maybe, John, but you've known Justin for a while too. So, John, explain to Justin what we're doing with the Superfan segment.
Well, there's things again that we know about you, and there's things we don't know about you. And what we try to figure out is what you're a super fan of that maybe you haven't told us. And you did mention something about college football, so I'm going to say that's off limits.
Yeah, that's fair, John.
But David, what are you a super fan of?
Oh, you know what? I am been a super fan of NASCAR for many, many years. I got roped into a Talladega event many years ago and fell in love with it, and went to many races there, but it has morphed over to F1. So I watched the F1 water slog in Sao Paulo over the weekend. John, what are you a super fan of?
Just last weekend, aside from being on the Jersey Shore and really marveling at the beach this time of year, we went on a kind of tour through the leaves in Jersey, which are still brilliant. And I am a super fan of going on autumn leaves tours.
The changing colors, yeah. So, Justin, we're going to take a shot, and you're going to tell us if there's a winner in the Superfan contest. We both have a piece of paper. We're going to write down what is Justin a super fan of, John, and ASU is not an option.
All
okay.
Right. And you'll notice again, Justin, that David, he's always above board in this, but he's got a lightning quick pen.
Yeah,
And it's amazing.
I'm just fast. I'm just faster than you, John.
Yeah, you really are.
So, John, let's see what your answer is.
All right, here we go. I used to be in like
Family trip.
Winnebago or something, but I think you still love to do those family trips, don't you?
All right. Yeah.
And mine is, I think this is the Grand Tetons, Justin. This is a picture. I would never go on your Facebook page. That'd be cheating. But if I did, you've had this picture as your profile more than once. And I think it's the Grand Tetons, and it might even be some iconic, I don't know if this is your property or some amazing place to visit. I don't know what this is, Justin.
Yeah, that's outstanding artistry right there.
Are you shocked by how he was able to do that in just seconds?
I know, he was so fast. Yeah. I'm floored. Yeah, that is Mormon Row in Grand Tetons, and I took that picture on a family trip. So you guys are we're like dueling here in our motorhome that we had at the time. We did a 5-week, 9 national parks with the family, and it was great. So right during COVID,
actually would have been a good one, because that seems like that's something you're really into, right? Going to national parks.
Absolutely.
Yeah.
So, John, I think we've done 31 episodes of the podcast. This is number 31. I don't think we've ever given the same answer before. Is this the first time?
Well, it was close.
It was close. Okay. All right.
Close,
well,
yeah.
Justin, you've been such a pioneer in this space. Looking forward to this discussion together. But before we launch into it, John, why don't you tell us about our sponsor, Behavioral Health Link, and its crisis software platform?
I'm always happy to do that, David. As a leader in contact centers that facilitate the coordination of broad-scale crisis care systems, Justin knows how important staying connected is to people in crisis. The BHL platform provides the technological communications infrastructure to keep your people in crisis connected to care, starting from the call center's greeting to the mobile crisis visit to their connection to outpatient care or a bed at a crisis receiving facility. And BHL's modules are designed for supporting and coordinating care for 988 call centers, GPS-enabled mobile crisis dispatch, outpatient referral and scheduling, evidence-based follow-up support, and real-time tracking to find crisis beds for more immediate care placement now. If you want to learn more about our state-of-the-art platform, just check us out at behavioralhealthlink.com. Dave?
John, when we first started this work, there was really no software in the space. And as we got going, it began to be a thing. And then 988 came along and it sort of blew up.
Absolutely.
I actually got this from an external company. I've talked to investment companies continuously over the last 20 years, but this is the first time someone shared with me their analysis of the field. They did 60 customer reviews is what they report. And I've blurred the competitors and the investment company, but they said BHL is the clear market leader in the crisis center software space.
Yeah.
We've been doing it for a minute, John. So, John, any reflections as you look at that?
I'd love to see that. I mean, I feel like we're the market leader. I think really what it comes down to is we never feel like we're the market leader, David. We always feel like we have more to do, that we have more to improve on. And, as the president of research and development, I'm never satisfied with what we have. I'm pretty satisfied. I feel good about it, but I feel like there's more that we have to learn and more that we can put into the platform to help all of our customers.
Terrific. So, Justin, our first segment is the good news. And we typically reflect on things that have been happening around the 988 or crisis space. And I'd like to, in particular, start with some work that you and colleagues have been doing at the International Council for Helplines around envisioning a world where suicide is not a criminal act. Yeah. You were working with John Brogdon and others at the International Council for Helplines. Tell us a little bit about this work you guys have been doing, Justin.
Yeah, so the International Council for Helplines, in partnership with Lifeline International, really taking on and spearheading the work around decriminalizing suicide worldwide. It is to some, and to me at the time, it was shocking that there are still countries out there that are where suicide is a crime, therefore seeking help or providing help for a suicidal crisis is illegal as well. And just as late as December of last year, Malawi prosecuted an individual for an attempt on his life and sentenced him to 18 months in prison for this unfortunate circumstance where that's not where they need to be. But we are seeing incredible improvements in a variety of countries. Nigeria, for example, recently decriminalized suicide, and we're seeing a lot of progress in other areas. I think it's a noble thing to do, where the global North and the global South can come together and really be able to tackle a critical issue. And then where Lifeline International comes in is really not just decriminalizing suicide, but making sure that we're putting a lifeline in place in those communities during that process to ensure that there is adequate support to meet the needs of the communities as these decriminalization acts are successful.
Yeah. And one of those partners is the Lifeline in Australia. John Brogden was the chair of the board for many years and has just written a book that you were telling me about, Justin, Profiles and Hope. John actually sent me a copy. We're looking forward to getting him on the Crisis Jam. I haven't unboxed it yet. I'm going to wait until the Crisis Jam to do that. But tell us a little bit about working with John and Lucy and the Lifeline folks. You actually made a trip to Australia.
I did. I was in Australia this past year, earlier this year, sorry. And my first time, that's a long flight. But it was great to be there and spend time. But I've had the chance to work with John Brogden for a handful of years now, and such an incredible individual, such passion. His wife, Lucy, his family are just incredible people. And his book is a great, very inspiring and fulfilling example of individuals that have struggled through a variety of challenges in their lives, and really being able to share their stories of hope and recovery and resiliency in brand new ways. So I had the honor of hosting John in the U.S. at the U.S. Capitol. We spent a couple of days together meeting with a variety of congressional members, staffers, leaders, to talk about the decriminalization efforts in ways that hoping the United States can get involved and support those efforts worldwide.
John Draper, one of my favorite John Brogden stories was we were talking with John years ago about the Lifeline funding in Australia, and he made the statement that it would never be reduced or cut in any way. And I said, well, how can you know that? And his immediate answer was, well, I know it because whoever would try to do that, I would destroy them by 10 a.m. And I was like, oh, okay. He cares about the work, Justin. And of course, John was, I guess I've called him the Nancy Pelosi of Australian politics. He likely would have been a runner for prime minister if he hadn't had his own suicidal crisis that was very, very public. The only thing he said when I've said that is he was more on the conservative side of the aisle than a Nancy Pelosi, but he's an amazing individual, Justin.
You know, Justin, our journey here in the United States to decriminalize suicide is really only recently did we kind of get past the criminalization of it. There was, I believe, 7 states in the 60s that had suicide or suicide attempts on the books as a crime. And it wasn't really until the 90s that they were wiped off the books. So it's still kind of new to us to get past this criminalization and reduce stigma. We're still working hard to get there.
Yeah, absolutely. There's a long ways to go. And stigma has such a long, deep-rooted history in a lot of different countries across throughout the world, and you could be a third world country, or you can be, progressive and still have the same challenges. I say with suicide, nobody is immune, no community is immune to the risks, to the stigma, to the consequences, and so the work that's done in the Lifeline space is just so critical.
Yes. Amen to that.
John, tell us what's your first question for Justin?
Well, I like to start, Justin, typically with where you started. I'm always interested in, I know you got into behavioral health before I don't know whether you stumbled into crisis or you chose to get into the crisis care sector of the work you were doing in behavioral health. But could you tell us how you came upon behavioral health? Was that something you wanted to get into, and how that happened? And then how did you get into the crisis care area in particular and fall in love with it as you have?
Yeah, it's a interesting journey. I'll be honest. I tried to stay away from behavioral health when I was growing up and in college. My mother worked in the field, in the industry. She was a CFO, so she was a finance person. So I said I never wanted to do what she did because she sat behind a desk all day and filed paperwork. It had the calculator with the ticking long sheet of paper that was coming out of it, and I said I do not want to be in that. And so I actually started out as a music therapy major in college, and so I had a full ride scholarship in music to be able to bring together my love for music and helping people. Then I had kind of this existential experience with it that I just didn't feel that I would be able to help enough people. It was really around, at the time, it was the early 2000s. So the only people who could really benefit from music therapy were those that could afford it. And a lot of folks that couldn't accept that their child may be disabled or have a challenge primarily around the autism spectrum. And it was really reserved for the extremely wealthy. And so I wanted to help people with higher level needs that were being disenfranchised for a variety of reasons. And so I really became passionate about working with individuals with serious mental illness and substance use challenges. And so I became a paraprofessional working in recovery homes and outpatient clinics. I was the guy helping teach people how to independent living skills, driving the giant van to group sessions, getting folks home. And so I transitioned my degree to social work, and then I tried to get away from my mother's shadow at the time and went into child welfare. So I was an investigator for Child Protective Services for a period of time. And but then I really got passionate about macro and policy level work in behavioral health. One of the things that I found is that the best clinicians that were so talented were being forced into administrative roles without the resources and passion for the macro level. And so I did my master's work really focused on policy and administration. And that's where I first dabbled in crisis work. I spent some time in a brief internship on mobile crisis, and felt it was something I wanted to explore further. And then I worked at the state and the Department of Health, overseeing behavioral health networks for Arizona, and then we hit a fiscal crisis in 2008. And what was in the crisis line item budget for the state of Arizona was eliminated. And I was tasked with making a case to the Joint Legislative Budget Committee in the governor's office at the time to argue what should be preserved, if anything, to keep crisis care alive in Arizona. So I took that task on. I got to meet crisis leaders, including David, at the time, and learning what is best practice, what does crisis services look like, why should Arizona care, and really able to put a budgetary line item together that we got across the finish line. Met a gentleman named Nick Margiata from the Phoenix Police Department at the time, working on the CIT coordinator, and did a ride along with him and just gained the passion and the need. And I knew this was an area that it took a special individual to do it and take it on, and I was up to the task. And then I transitioned to Magellan to implement the changes that we were able to get pushed through at the state level in Arizona, and really be able to transform with reduced costs. We lost half of our crisis funding, though we were able to preserve $16.3 million in the state line item. But that was really where I gained the passion, and I really got boots on the ground doing ride-alongs, so spending time in stabilization facilities overnights on a Friday just to see how things work, the mechanics, sitting in the call center, riding along with mobile teams and law enforcement, and just saw again, the passion and the energy and the impact that these individuals make every single day. Lives are being saved. And so I wanted to be a part of that.
Yeah, I hear the passion in your voice, and coming all the way from music therapy.
Yeah.
That's a great story, Justin.
And Justin, we haven't seen you on the stage at Crisis Con with your guitar like Travis. What's the holdup, Justin?
Yeah, I'm a drummer.
Oh, you're a drummer. Okay.
And so a drum solo just does not exude that passion. I was always jealous of guitar players or piano players that I couldn't win my wife over with a drum solo, and so I had to not tell her about that until I'd won her over. Yeah.
So Justin, you cut your teeth on an innovative system with a full continuum of care. But that's a newer concept to many of the crisis centers in the United States and around the world. As you work with your partners at the International Council for Helplines, and as you see crisis centers across the country, how do you think they're doing with this transformation? And what advice would you have for them as a call center thinks through more of being absolutely coordinating and engaging with mobile and facility and all of these other components?
Yeah, I think we have such a great diversity of contact centers throughout the U.S. That are supporting 988 and other initiatives with a passion in the heart. What's hard, many started out in the 60s and really have been extremely effective at it. But we're at a unique stage now where we have congressional oversight with expectations of performance and standards that have never, and scrutiny that we have to be aware of and working through all the time. And so I think being innovative, being open to change and progress in a way that that's advancing at a much faster pace than we ever have seen before. And so we're seeing accreditation bodies like the International Council for Helplines and AAS coming alongside the 988 from Samson Vibrant to really be able to help nudge the system forward at a pace that is sufficient to really meet, again, the oversight demands that we're getting from Congress. And crisis lines have always, to me, in my experience, in the crisis system, has always kind of been an afterthought when it comes to behavioral health care. And we are now at the forefront. We're in a moment now that it won't last forever, but we're in a moment to really capitalize and show the world what an impact we truly make in healthcare outcomes.
So, Justin, let's reflect a little bit on the field. And I want to bring up a graphic to show the poison control centers that they matured, emerged in the 60s en masse. By the 60s and 70s, they reached a peak of 660 some odd centers. But for the very same market force reasons that you were talking about, Justin, those actually consolidated over the course of time. And I think we have 55 of those centers today. It's not quite one a state, but it's somewhere in that,
I think only Texas
range.
Got multiple. I think they have 2, maybe even 3.
Solari started out here in the Phoenix area, but what's that been now, Justin, that you went statewide? Has that been 2 years, 3 years now?
Just over 2 years.
Just over 2 years that you became the statewide vendor in Arizona. You're now the statewide vendor in both Oklahoma and Colorado, as John talked about, a model that Behavioral Health Link in the state of Georgia started in 2006, and we've seen some other states. So the over-under question for today, John Draper, is how many states do we have a single crisis call center in? We've mentioned 4 of them with Georgia, Arizona, Colorado, and Oklahoma, but there are others, some which explicitly tried to model themselves over that single state approach, and others that that's the way it developed over the course of time. I asked ChatGPT, John, and it made an answer up, which was inaccurate. Yeah. So I had to go back and do the work myself, going to the Vibrant website and going through the states. But how many states have a single vendor in a statewide approach?
Okay, Idaho is another one, so that makes 5. I think New Hampshire would be 6.
So the way this is going to work, Justin, is John's going to come up with a number, and you're going to say it's higher or lower than that.
Gotcha. All right.
So I'm going to say I'm going to say 9.
9. All right. So let's hold that for a second, Justin. Let's do a second. This is a double feature over under, John Draper. There are states that have more than one. There are states that have many. There is a state that has the most. What is the number in the most state, John?
19 in Ohio.
19 in Ohio. So over under, Justin, over under 19. John got bonus if he's right with Ohio. Over under 19 in Ohio, and over under 9 for the number of states with just one.
All right. So I'm going to go dead on with 19 in Ohio. I think Florida is a close second behind Ohio. And the over-under, I'm going to take the under on the number of states. So I think the number is 8.
Yeah. So I think John's got you on both of these. Here's the problem. You know that 19 is in Ohio, Justin. That's correct. It's 19 in Ohio. Let me just show the map. The problem with the over-under game is if the person guessing it gets it right, then you're screwed. So It is 19 centers in Ohio. And John, I thought you know Ohio, but I'm surprised both of you knew the exact number. That's terrific. 19 centers in Ohio. So they have a very different
anomaly, and it's just so unusual to have. It's a small state, relatively small state.
Now, and I'm not saying this is the truth as God sees it, but this is what I got looking through. Idaho. Actually, I do have Idaho on the list, John.
Nebraska, yeah.
And I think there was one of your states, Justin, where there was another niche organization that was mentioning, but I still put it on here because, like, Native and Strong is a little bit a different thing than what Washington State is doing. But Washington State
have a tiny little center too, in addition to the 211.
Who is that, John?
I think Connecticut's got a tiny center. In addition to the 211 center.
It might. So I was just trying to scan through what's on the 988 map website. So Arizona, Colorado, Georgia, Oklahoma, New Mexico, all of those are in that wave of following that connected to the behavioral health system, coordinating a full continuum of care, involved with payers, that kind of more that higher level model, Justin, that the regulatory that Congress is looking for as we go through. Not that you can't do that with 19 centers, but the demand is just harder on smaller organizations.
I think Virginia and Wisconsin might be suspect on here too. I think there's multiple in Virginia and Wisconsin.
Any comments, Justin?
Oh, I think there's this number is bigger than I thought, but and of course our friends in Utah are also doing exceptional work with their system and integration.
Yeah, absolutely.
All is possible. You know, that's the piece. I had a great opportunity to attend a session at Crisis Con with the Ohio group talking about their 19 centers and their coordinated effort. That's hard. It's a big lift, but they make it work, and so it's there's a lot of variability, a lot of opportunity, and that's why I think the earlier statement around being able to progress and evolve and adapt is critical. Those that are willing and able to can succeed. But part of what we're seeing with states is they're wanting to contract with fewer centers, so they may look for an administrator that's overseeing a group of centers or directly to a single provider.
Right. So I think two things I'll comment on this. One, both of your numbers, the 8 and the 9, if you look at the states in here that are distinctly sort of trying to replicate that one state model, that's probably closer to 8 or 9, right? It's not all of these states. Utah is definitely one of those. Arizona is definitely one of those, et cetera. The other thing is, Justin, it's interesting you talk about that 19 can work. We talked about poison control going this way. 911 went the other way. 6,000 911 centers across the country. In LA County alone, I believe there are 80 PSAPs with 20 specialized dispatch, and they do coordinate seamlessly. I don't know that they're all on the same software application, but I do know that they a phone call between them lines up the data, regardless of which center it is. So it's fascinating the way this continues to move, Justin. So let's go to our next segment, John. And I want to ask Justin, following up, Ohio is a different model. In that single state model, Justin, which Solari is the operator in 3 states, what do you think is the most important ingredient in managing that approach?
Yeah, I think the single state, or especially transitioning from a multi provider system into a single provider system, I think is really have to spend a lot of time and energy learning and partnering with the local community providers. Though at a state level, the contact center can operate, the value of the contact center is really limited on its ability to refer and coordinate with local providers, whether it's mobile crisis teams, stabilization, peer respite programs, and an ongoing therapeutic relationship with providers and health groups. And so that's really where, and it takes boots on the ground. You got to get in a car and you got to drive and you got to go to every corner of that state and build those relationships face to face. And it was hard through the pandemic. We were successful in doing that in the communities in Oklahoma, for example, and in Arizona. And we're in the midst of it right now in Colorado. And I crossed the international date line. I Continental Divide 4 times in 2 days, touring the Western Slope in Colorado. And we're just scratching the surface of being able to build those relationships and building those trusting partnerships in the communities that we serve.
And I imagine you've got offices then to have boots on the ground. You have offices in Colorado. You have offices in Oklahoma, where you're also operating, just like you do in Arizona, right, Justin?
That's correct. We really take a philosophy. We really believe in hiring local. Yeah. And so in Oklahoma, we have a contact center in Oklahoma City. A bulk of the staff are remote or through a hybrid contract relationship, but we only hire within the state of Oklahoma for serving those groups. And in Colorado, we take the same approach, and in Arizona. And so we don't have flow over calls back to other contact centers. We keep everything captive within each state that we're providing services in. So
you mentioned how crucial partnerships are, and you're making that really work in Arizona in ways that people are taking notice, Justin. Like your partnership with law enforcement and 911 is really making a difference in diverting unnecessary calls to 911 and unnecessary encounters with cops. Can you talk a little bit about how that's working for the crisis care system in Arizona?
Absolutely. Arizona, I think, was an early adopter with CIT and the Memphis model back to the early 2000s, and we really jumped on board with that, and really we're maintaining fidelity to that model wholeheartedly. And so we were great at getting, once an officer is on scene, being able to get the proper training, resources, and getting a handoff at that point. We really started thinking, really in the past 5 to 10 years, around how do we upstream and engage and prevent the officer from being dispatched altogether if it wasn't necessary. Mm-hmm. And so as we saw workforce shortages with first responders, with 911 dispatchers, just like we see in the behavioral health system of workforce challenges, we felt we had an opportunity to kind of capitalize on that. And so we partnered with a number of cities, starting with Mesa in Arizona and Phoenix, around co-locating staff, not to take crisis calls in the 911 dispatch center, but to serve as a liaison to build the trust and relationship of when is an appropriate time to move a call from the 911 center over the PSAP over to the crisis line. We cross-trained and toured each other. So we sent crisis line staff into the 911 centers to shadow and learn their culture and the way that they operate, and then vice versa, bringing 911 dispatchers into our crisis line environment to really be able to again, it's really built on trust. So we've done pilots in the past where we send somebody in to take calls, and we get a handful, but it's this person doing this work on one side to really being able to shift a culture. And so right now we're pulling about 3,000 calls a month out of the Phoenix police PSAP into the crisis line, and we're having extremely high success rates of stabilizing 50% of those calls on the line. And the mobile crisis teams that are being dispatched to those in need are also at a high stabilization rate of over 50%. When we're hearing their reports back from the PSAP that over 90% of those calls they moved would have resulted in a first responder deployment.
That's really impressive.
Yeah, of course, Justin. They're going to roll a truck, a car, or an ambulance, right? That's the model. So if you're able to come up with a different outcome, you're dramatically changing the cost, the impact for the individual and their family. That's amazing.
Huge.
Yeah. So it's been a great, in reducing unnecessary dumps at emergency departments. We're seeing so much dispositioning to emergency departments that are, again, understaffed, ill-equipped to be able to meet the needs. That's not a great environment. And being able to divert folks to crisis stabilization facilities, to mobile crisis teams to come out, again, a high rate of stabilizing within the community and a low rate of needing to re-engage with 911 and PSAPs at a later point.
So, Justin, we'd never put you in a position to pick your favorite child, but this next segment is pick your favorite child. So Colorado, Oklahoma, or Arizona, Justin, just come up with the first thing that comes to your mind. Natural beauty.
Colorado.
Colorado. So you're going to pick the Rocky Mountains over the Grand Canyon, Justin.
I am. I've lived in Arizona almost my entire life. And so I think I was born grew up in the wrong state. I like green. I like water. I like rain. Snow. I've gone years without seeing snow before.
Yeah.
And so
it's a lot like sand, Justin.
I've heard.
Are you skiing yet, Justin, or have you always been a skier?
I was in my youth and my much thinner days. It hurts my knees and ankles now as I'm getting older.
Yeah.
But I'm willing to try it.
All right. So we got one vote for Colorado. Food and drink.
Ooh, food and drink. I'm going to go Oklahoma.
And why is that? Is it barbecue? What's the Oklahoma?
Steak,
their steak is it's like butter, and it is like there are restaurants there where you can get a steak, a filet mignon, full meal, potatoes, corn, drink for $26.
The 72-ounce steak that you have to eat in an hour.
Yeah, it is half the price of what I pay anywhere else, and it is incredibly fresh. And so they have a restaurant right in the Stockyards area that is just exceptional.
Okay, well, we want to go there, Justin. Entertainment and culture. I know you're into the arts and.
Yeah, man, this is tough. I'm going to go Arizona on this one because it's improving. Colorado has a great arts district as well, so I'm a little torn. I think Arizona's trying to replicate what Denver especially has done in the arts area. It's cool to see it improve to such a great degree in Arizona. We've not had a great arts and culture history, but if I'd say where we are today, and if you go to Tucson, the Tucson Arts Culture District is just incredible. And so I'm going to go Arizona on that one.
I'm going to skip the education and innovation because that one I know what the answer is going to be on that one. Look, you're hiring people in all of these states. Cost of living, Justin?
Yeah, so cost of living is highest in Colorado.
Yeah.
Mm-hmm.
Yeah.
Yeah, that's because it's the most beautiful state, right, Justin?
Oh, my gosh. It is. And the people are incredible. Each community has such a rich value and if you're going to ask about friendliness, Oklahoma are the nicest people I've ever met in my entire life. I never felt like a New Yorker coming to Arizona. It's like the same degree of separation between Arizona to Oklahoma. And so just a funny segue with that. When we went to Oklahoma and opened up shop there, we brought some Arizona staff over to help with the go live and training. And as soon as we were picking up calls, people were like, "You're not from here." And their friendliness carries over on the line, and so actually the length of call was longer. So we had to modify our staffing, to match the tempo and just the nature of the calls that come through in Oklahoma. And so we saw a massive improvement in feedback, in positive feedback, once we had local staff taking the calls.
That's terrific. Terrific.
I'm glad those calls were somehow routed to New York, Justin. They wouldn't have taken that slow pace.
No, it would have been catastrophic.
Yeah.
So, John, we talked about law enforcement, but you were thinking about some
Yeah,
other
yeah.
key partners.
Well, I mean, I was thinking about this way you're talking about law enforcement, your partnership with law enforcement, and how that was making a difference in 911. But also, you're doing some interesting things with EMS and fire. These are kind of untapped partnerships that most of our crisis centers haven't really tapped yet. And I'm wondering how you're partnering with them in ways that are making a difference for crisis care in Arizona.
Yeah, fire and EMS it's got a unique challenge. That's kind of the undertone of all of this, and that's really where reimbursement and funding comes into play. And so, one of the biggest challenges that we've seen in a number of states is that cities are dependent, and municipalities are dependent on the reimbursement rates from dropping individuals off at an emergency department after interaction with fire and EMS. And so being able to shift the reimbursement models to ensure that crisis stabilization facilities are acceptable disposition locations, handoffs to mobile teams, provides some level. It's not the same reimbursement rate, but it's providing something to do that. And so we're finding more success. It's a slower pace. I'd love to be further along than we are with law enforcement, but that was a 20-year journey with law enforcement, where I've seen fire and EMS are doing much better today than we had been, and in building those partnerships. We have local, at least Tempe, Arizona is an example. They have a group called Care 7. They're tied to their fire department. We're actually dispatching them from our crisis contact center dispatch team in partnership, and so we're rolling out a mobile crisis team thereafter. And so we may not be out there as quickly as the engine is, but we're finding that the value of that ROI, we're able to do handoffs again to mobile crisis and community stabilization at a much higher rate.
That's great.
Justin, 988 has been such a transformative movement within the crisis industry and the public overall. What are you seeing as the most significant impact of 988 in its first 2 years?
Public awareness is first. Being able to that it's open and available and free to everyone, and getting that there across that point, and then really starting to nail down responsibility for sustainability when it comes to 988. And so, getting states more invested and involved in the 988 funding and marketing processes, I think, is a big improvement. And then really crossing that, 988 rides this public health to healthcare line. And I think it's a critical partnership there between its role as a public health service and in a healthcare continuum. And I think the data shows that we reduce healthcare costs by existing and being able to do the proper handoffs. And so I think being able to tell that story through data is really important. And I think we're seeing stigma drop at a high rate, much faster than we've ever seen before. So those are kind of the few nuggets, I think, from the value perspective.
Justin, you referenced your partnership with 911 and being able to divert calls over. Are you seeing higher acuity on those calls? And are you seeing 988 move calls from 911 on its own? Is it changing the intensity of what would be the historic volume on your crisis center, or not so much?
Yeah, it's a great point and a great question. I think we're finding on our state direct lines versus 988, we are having a higher acuity level on the 988 lines. Mm-hmm. And then those that are coming over from 911 dispatch, we're having a higher acuity rate. Not necessarily suicidal related crises, but much higher rates of depression and anxiety and social concerns that are coming up. Yeah. But we're also breaking the cycle of recidivism through changing the behavior. Let's call the crisis line next time I'm in this state versus going back through 911 repeatedly. Just the number recognition of having the 3 digits that was so critical for us to get across the finish line. And both of you played such a huge role in getting that 3 digit across the line. I think is really the big game changer in public awareness and breaking down parity, which I think was also critical in addressing stigma.
Yeah, it was. And it's interesting too, while you're getting more acute calls, when it was called the National Suicide Prevention Lifeline, about 25% of our calls were suicide related. Still 75% weren't. And I'm wondering, I wonder, what percentage, what's the proportion now of the percentage of suicidal calls? And now it's called the 988 Suicide and Crisis Lifeline. So the idea is to make it even more expansive and available.
Yeah, we're seeing shifts. Part of it's seasonality. When school is in session versus when it's not has an impact on volume and primary need. Social concerns are also very, very high. Bullying, being able to outreach for things like bullying, internet-based domestic partner relationship challenges are coming across at a higher rate than we saw before. Suicide risk is still typically our primary issue that's coming across. But people are willing to outreach before they reach that point. So depression and anxiety, like I'm not actively having thoughts of harming myself, but if I don't get my anxiety under control, I will end up in that state at a later point. So I think we're really upstreaming and engaging folks earlier on.
John, I think Justin was quite a suck up to his new states with Oklahoma and Colorado in that prior segment. So let's do some segment. Let's give some love to where Justin did grow up, which is Arizona. And this segment, Justin, we're going to call the In the Ballpark or Not So Much. I'm going to ask a series of questions. John's going to give an answer, and you're simply going to say in the ballpark or no, not even close. So, John, number one, Phoenix holds the record for being the hottest major city in the United States. What's the high temperature that we've reached?
118.
Justin, in the ballpark or not even close?
Not even close.
It actually says as high as 122. I remember 122 when the airport closed, Justin, because I guess the formulas for takeoff no longer work. Do you remember a higher, Justin?
In Phoenix, it was 122. Where I grew up, east of Phoenix, it hit 123. And I was playing baseball at the time outside that day, and they were like hosing us off. The parents were hosing. My coach wouldn't even get out of his car to come with us, so parents were trying to hose us off. We still played.
Coach didn't care about the health of the kids.
He wanted to win. It was all about the win.
So, John, did you notice that you were only 4 degrees off, and Justin said not even close? That 4 degrees makes a difference, John.
That's what your souls melt to the pavement at that point.
All right, the next one. We're the Valley of the Sun for a reason, John. How many days of sunshine do we have each year?
I would say, I'm going to put it at, you mean any kind of sunshine at all?
No, it's like full sun, not a cloud in the sky.
Oh, not a cloud in the sky. Okay, cloudless. All right, let's say 340.
Not even close.
So 340 would be we would all die. It's the number one in the country. It's 300. That's about how many days you have with clouds and or rain in Seattle. So it's exactly the opposite. The saguaro cactus is our thing here, John. They have these arms that come out as they get older. They live to be how old? It's a cactus, John.
Yeah, I'm going to say 70 years.
Justin?
No. It takes 100 years for the first arm to grow.
Oh, wow. Really?
So they can grow as tall as 50 feet, John, and they can live 150 years.
Wow.
So the McDonald's franchise was born in San Bernardino, California, but Ray Kroc was the one who franchised it. The McDonald's brothers didn't know how to do that. The first McDonald's that was franchised out of California was in Phoenix. In what year, John?
I'd say 1965.
Justin?
I'm going to say he's close. I'm going to say
I don't know what we call close. 1953. I'm going to say that's a lot earlier.
That's a lot earlier, yeah.
I would have said the 60s too, Justin. Last one. This is a premier place for golf enthusiasts. The Waste Management Phoenix Open is one of the most popular events on the PGA Tour, drawing massive crowds. How many golf courses do we have in Phoenix?
In Phoenix? Wow. I'm going to say 20.
Justin, are you a golfer?
I try to be.
I bet
But-
Justin's been to 20 courses. Is he in the ballpark or not even close?
Not even close.
200, John.
Just seems not the amount. Incredible.
Hey, Justin, last thing as we're wrapping up our discussion with you, Arizona's been quite an innovator in this space and was the template for a lot of the work with Crisis Now. And why? What was different about Arizona? Because we were really, really late to developing behavioral health infrastructure in the United States, but we became one of the primary innovators in the crisis space. What's the difference, Justin?
It was not politics. As a very historically red state, frankly, it really came down to a lawsuit in the early '80s that sparked this momentum. But again, crisis came last. It was late, and so we were late to the game. But it really took innovators and to really be able to tackle this. And then really I think a tipping point was the blending and merger of our state Medicaid agency with our behavioral health division at the state level under one entity to really bring the Medicaid aspect, the grant aspect, and the state appropriated funds management under one entity, really one mission that really drove this forward. So I would say those are the two really tipping points, I think, in crisis care in Arizona.
Justin, I was one of those who feared that integration and the dissolving of the Division of Behavioral Health. Did you see the potential right out of the gate, or did it come for you later?
It came for me later. For me, it was really, my fear was that are the leaders only going to understand medical primary care side and not have an understanding of behavioral health care? And now you have a medical director that's a psychiatrist. You have lots of a director who comes from the behavioral health community and integrated clinic communities. And so it's everything I was concerned with was put at ease quickly.
So, John, what a pleasure working with Justin today. But that brings us to our incredibly true tales of Behavioral Health League segment.
I couldn't wait. I'm so excited, David. Let's get those true tales out there.
So Justin was referencing visiting Canberra and Sydney as part of his work with the board of directors for the International Council for Helplines. I made a similar trip in 2014, and this is me, John, sitting on the plane as we arrived from that 15-hour flight in Sydney, and we sat over at the edge of the tarmac because we had a threat on the plane. And it was a very anxiety-provoking 45 minutes while we waited for that to be resolved. But the irony is I had joked with some friends of mine because this was just weeks after the Oceania flight went missing. You may remember. Right. My friend's wife had said, David, I'm concerned about you making this trip. And I said, I'll tell you, my concern is if this flight is hijacked and I don't get my Delta Sky Miles credit for the additional distance. So I had mocked her concern, and then I was stuck on the runway. But I tell you what it did, we did learn from that, is that air traffic control doesn't follow you over the oceans. When you are in the domestic corridor of the United States, 30,000 flights a day, every one of those planes is followed with a hand in a hand. There is a person accountable for where that plane is and where it's going, and they keep track until there's a safe handoff. But that doesn't occur once you leave the continental United States. There's no ownership out there, and it is that model, John, of high intensity service referral tracking that led to many of these states taking a single vendor approach, Justin, of making sure that we have the resources and the wherewithal to hold that hand, so we're not 10 years later still wondering what happened to that flight, John.
That's interesting. David, I mean, all that makes sense, but did that actually really happen to you?
John, I would say you were there too, but John, did you go to the Sydney Zero Suicide Summit years later?
I missed that one.
So this is a rare chance, John. I'll say you weren't there, and then you weren't there again.
Yeah, no, I was not there, but
yeah, okay.
I'm sure all of that happened, David.
Well, John, whether that happened or not, let's get some things that let's get some plain truth, John.
I'm ready to give some. And, our guest today alluded to the vital role of mobile crisis teams in the crisis care continuum. And we know that mobile crisis work is the new frontier for 988. It's the next priority across states and counties, seeking to build out crisis care systems that will offer a public health alternative to 911 sending cops and strobing lights to homes of people in behavioral health crisis. But a 2023 survey of states by Nashville's Research Institute published last July reported that 49 of 50 states and Washington, D.C. have mobile crisis services, with over 770,000 people served last year across the 40 states, reporting an increase of 21% in the number of individuals served by mobile crisis teams in 2023 compared with 2022. And I suspect with a good deal more state funding flowing into mobile crisis services this year, we're going to continue to see similar increases in people served in NRI's next year's survey. So that's great news, no matter how you slice it. But with mandates occurring to create teams, how do we know these investments are really making a difference in the lives of people in crisis? What guidelines are states using to measuring the performance of mobile crisis teams in serving people in crisis? And how has SAMHSA addressed this issue? Well, in 2020, SAMHSA released the first national guidelines for behavioral health crisis care, with a revision set for release later this year. Now, these guidelines outline key objectives for mobile crisis services, such as rapid response for individuals of all ages in crisis, de-escalation, enhancing safety, and connecting people in community care whenever possible. In SAMHSA's 988 report to Congress in December of 2021, they included this often seen figure illustrating the objectives of the crisis care continuum, noting an expectation for mobile teams to resolve 70% more of their contacts in the community, without defining what resolution for clients being served by teams entails. SAMHSA's major goal for teams and the 988 crisis continuum is highlighted in this illustration and in the national guidelines as reducing unnecessary interactions with law enforcement and emergency departments, referred to as diversion goals. This is what we often hear about as diversion rates, and many states prioritize diversion rates as the main metric for mobile crisis effectiveness. We've been talking about that today. But in 2022, Dr. Matt Goldman and Preston Looper, and Preston's going to be on here soon, but they conducted the largest ever national survey of over 500 mobile crisis teams. It was published this year, but happened in 2022. And they found that less than half reported diversion rates. Well, while more teams may now report the percentage of contacts that avoid police and emergency departments than maybe in 2022, diversion rates alone don't fully capture the outcome for clients served by mobile crisis teams. First, there's going to be situations where diversion isn't clinically appropriate. Some people require more intensive care, and immediate public safety concerns sometimes do necessitate law enforcement involvement. And second, most mobile crisis encounters are one and done with limited follow-up. So it's unclear if a person later encounters the police or is admitted to the hospitals. And lastly, focusing solely on diversion rates overlooks whether the service helped individuals feel safer, or less distressed, or more hopeful, or connected to needed care. Clients likely wouldn't consider their experience successful just because they didn't go to the hospital or see the police. Now, what do mobile crisis teams think should be measured? At BHL, we host a community of practice for mobile crisis leaders using the BHL Mobile Crisis Dispatch platform, now in use across 12 states. And when we surveyed our members, they ranked their most important area of focus, which was measuring meaningful clinical outcomes for the people they served, moving beyond just reporting diversion rates. Now, these outcomes include measuring the extent to which teams de-escalate crisis or reduce distress, the extent to which teams are reducing suicidal or violent thoughts, and reporting on how teams are successfully connecting people to community services. To what degree are we measuring these essential outcome areas now? Well, regarding tracking and reporting on safety, the survey of teams showed that most conduct safety planning and lethal means counseling, but very few report how frequently these interventions are applied. However, the team survey noted that over half of teams reported suicides or attempts during or after visits. Those such incidents are pretty rare during team involvement. What's really more frequent are suicidal ideation, and no teams are reporting changes in suicidal ideation during their contact, despite it being both common and crucial factor to assess, track, and report on. Moreover, no teams or states are tracking reductions in distress or other indicators of crisis stabilization. Some states report that crises are resolved at certain rates, but the term is not really clear, and it's not defined by the clients. Nearly 60% of teams report on whether individuals are connected to care, but success rates vary widely, with most states still focusing on whether services prevented police or hospital encounters. Now, when we surveyed the mobile crisis team members of the BHL platform's community of practice, it didn't surprise me that their area of greatest interest was improving was how we improve the defining and reporting on clinical outcomes. That seemed to be the most important thing for them. And that didn't surprise me, because when I worked on a mobile team, I was so proud of the work we would do. And I knew it was making a difference with the people we were helping. And later, as the clinical director of that team, I was particularly interested in tracking and reporting on whether our staff was doing a good job and where we needed to improve our care. And it doesn't surprise me that nearly 30 years later, after I left that job, the current mobile team members still feel the same way about measuring how their work matters. However, it does surprise me that today, nearly 30 years later, very few, if any, mobile teams currently report on how well they are reducing crisis states, reducing safety concerns, and connecting people to care when they need it. That is, reporting on measures that matter. Now, this is an area that we are passionate about at BHL, and we aim to collect and report on this data. In our view, the most important viewpoint on whether a crisis is resolved or not is in the mind of the person we're serving. And we invite all states and counties funding mobile teams to join us in measuring the outcomes that matter to the people we serve. David, that's a wrap.
Thanks, John and Justin. And that's the plain truth, John. You and I both started out doing mobile crisis teams, and all three of us were engaged in this work over the last 20 years in particular, where we went from call centers lacking the kind of professional orientation that an industry needs to advance, and seeing practice standards and research and funding and expectations and growth. And we're starting to see that same movement in the area of mobile crisis. And it's an exciting time as that moves forward over this next 10 and 20 years, John.
Yes.
So the resources that 988 has extends into those kitchen tables and apartments and under those bridges.
Absolutely.
Huge thanks to our guest today, Justin. Thank you for the amazing work you're doing in this industry and in your states, both nationally and internationally. And be sure to join us next week, when our guest will be another Arizona pioneer and healthcare executive, crisis guru, Erica Chestnut Ramirez, who is a regional vice president at La Frontera, Arizona, with Impact Suicide Prevention Center. So thanks again for letting us draw you in this week, and come back next time when we will continue to navigate the currents of crisis care. Until then, remember, every call, every life, every story matters. Stay connected, stay supportive, and we'll see you on the next Lifelines.